Hi, I'm Dr. Sedna Bokiria, and this is LeaderVoices, a show about leaders and their infinite ability to change the world. Each episode in LeaderVoices, we dig into stories and sparks from for-purpose leaders, coaches, comedians, luminaries, and everyday heroes from around the globe. Tales of impact and failing forward, of aspirations and innovations, and the infinite and inspiring ways that social purpose leaders lead and make the world a better place. Join us today as we introduce a new guest. It is a great pleasure to welcome our next guest to LeaderVoices. Kristen Ann Butler-Cummings is the National Director of Key Account Management and Strategic Advocacy at Pharmacosmos Therapeutics. I know it's difficult to tell based on her youthful glow, but I swear to you, she has been in the healthcare sector for over 24 years. She is embarking on her 10th year of leadership in pharma. And as many of our listeners know, a decade in the pharma industry means that she's witnessed and experienced drastic shifts in innovation, regulatory landscapes, patient-centered approaches, and market dynamics. Just the way in which everything's changed in the industry post-COVID, it's remarkable to have you on the show as a person who's been in the sector for 24 years and been in a leadership position for more than a decade. Kristen's focus is on creating partnerships for patient advocacy, and it is a pleasure to have her on LeaderVoices today. Thank you for joining us.
Yes, thank you, Sedna. Honor, humbling to be here for sure, and super excited for it. Thank you.
Yeah, it's so great because last time we connected, it was at ASCO and, we got a chance to kind of connect. And, I love connecting with women in leadership positions in particular, especially in the biotech and pharmaceutical space, because it's just fascinating to understand how much the industry has changed, how quickly it has changed. And so it was just immediate for me to try and get you on the show as quickly as possible. So I really appreciate you coming on. So I'm thinking with essentially your experience, it almost sounds as if you knew in high school and undergrad that you were interested in training to be in the healthcare sector in some capacity. Tell us how you got started on your path and how you essentially shaped your career.
Of course. So really interesting question. I've actually just embarked on some mentorship within Pharmacosmos, and it was a similar question of like career path and how did you get to this point, or just know that this is where I would like to be. So I think life is always, where you end up is always a series of events, a series of decisions. I think the root of where I am and how much I appreciate my career is that I just always want to help people. And that's where it definitely starts. So through high school, that desire to help people, into the universe aligned me with my best friend, Sarah, who's also in pharma, and her mom, who had a clinical research org location. And she also had an assisted living facility, privately owned, private residence for assisted living. So it was in those two experiences where we were able to become certified as, nursing assistants and work in the assisted living facility, but then also to work at the clinical research company in recruiting physicians for studies, collecting regulatory documents, right? So a lot of exposure to pharma and to healthcare through both of those experiences.
Yeah, and that's not for the weak-hearted. Assisted living is not for the weak-hearted. It is so, you can't not think about mortality and purpose when you're in settings like that.
When you're observing it, right? So we were young, right? In high school, working, managing, doing everything from bathing the residents, feeding the residents, working with med inventory, cleaning the house, right? We were basically the sole provider while we were on shift at the assisted living home. So it's not for the weak. Overnight shifts were pretty tough. And there was a lot of really good uplifting moments, though, along with the challenges. So definitely worth it, and certainly helped shape my career and, my desires moving forward from that point.
Yeah. And the other thing, because when I was in high school, I volunteered in an assisted living home. We had to do, like 100 hours of community service. And a lot of my family members still, my stepmother works as an assisted living nurse to this day. And I remember volunteering because, I kind of had the in, like I had to do this community service. And I'm like, oh, my cousin works there, so-and-so works there. I can do my 100 hours. And I remember, we lost, I would make like these connections with these patients and then we lose them. And it was so devastating to,
Yes,
at such a young age, to experience that. How did that type of experience shape yours?
I think prior to high school, it's an unfortunate thing to be touched by death in family or adversity. So, my upbringing was always a little bit, dysfunctional, chaotic. And I, been close to death a few times with really, close family members. So, I don't think I never really felt like it was difficult. I always felt like it was where I belonged, and that I was bringing something to all of those moments that really helped everyone that was involved in those moments. There were definitely patients that or residents, I should say, that I was close with. Actually, just cleaning out my jewelry box the other night, I found a heart-shaped locket that was from a resident named Lily, who, not to be too grotesque, but she had a colostomy bag and we had this horrible accident. And because I handled it with such grace and helped her keep her dignity through it, she gave me this necklace, and I still have it to this day. It's a beautiful silver crystal heart-shaped pendant. So there's moments like that I think carry you through, and I just always want to help people and want people to feel comfortable. So those were just a lot of opportunities in that role to do that.
I say it, not jokingly, but it's not for the weak-hearted. You have to be an extremely dedicated, caring person to be able to do that with the level of compassion and respect that is absolutely necessary. So, thank you for sharing that. So thinking about kind of jumping into leadership. So let me rewind a little. So I feel like many times people see the path of leadership as kind of like, picture a staircase, right? So it's like step, 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 and then you get here. Tell us about your path of progression in terms of the leadership aspect. Like, where did you start and how did it go? And did it go like this, or was it kind of like all over the place?
So I think it was a little bit all over the place. But I answered this question not too long ago, and it was a similar question, like, at what point did you realize that you were destined for leadership? And I still don't know if I have fully accepted that, like, destined for leadership. But I'm definitely at a point where I'm recognizing that regardless the environment, I'm in a leadership position. Right? If it's at the head, or if it's, amongst the people and leading and collaborating or something. So fourth grade, this is going to sound so funny. In fourth grade, I was, in the highest grade in elementary school on the bus. And the second I got on the school bus, the bus driver's like, you're going to be the bus captain because you're the leader on the bus. And it's like, okay, I don't really know what that means. She's like, no, you're going to be fine. Just know that, like, if anything happens, you're the kid in charge. You're going to be my right-hand person. I'm like, this is so odd. But I accepted it. I was also really active in 4-H growing up. And at a young age, like elementary school, I was in positions like secretary or vice president of the 4-H club. Right. So like, there's always been these moments, even from a very young age, that I was, in leadership. Mm-hmm. So
tell me, what's 4-H though? I don't know what that means. I have
it's an agricultural component. Yeah. And I always forget what the 4-H's stand for. My husband will crack up laughing when he's like, hands, heart, something. But my 4-H project was my horse, or a horse that I had at the moment. So typically it's like equine or, hogs, or it's showing animals or agriculture based. Yeah.
I see. Okay.
So
Very interesting.
I grew up in a very rural part of Pennsylvania, and rural America, rural healthcare is really a big part of who I am. So was really active in 4-H growing up, and that lent itself to some leadership opportunities even at that point in life. And then moving into middle school, high school, playing sports, captain of the team, college. I was also active in RTC for a while. So there's a lot of leadership development and opportunities all along the way that I just was on the path for. But I do remember my first role in pharma, immediately raising my hand. I want to be a manager. And it was like, well, you've just started. You're barely 23, and good to know, but you're not there yet. And I didn't understand it because my whole life, right? Captain of teams, president of clubs, everything.
You're the bus captain. Come on.
I was the bus captain in 4th grade. Like, I have all this leadership experience. So it was humbling. And I look back now realizing that, you don't always have the right experiences, qualifications, or, to fall into leadership. But at that point, I knew I really wanted to dive into the career. I love healthcare. I love breaking down barriers for patients. So I just really focused on, ensuring that I was doing the best possible job that I could do. And, leadership development opportunities then arose from there as well. But it was 15 years into my pharma career before my first management position that I could truly accept came available for me. So it was a little bit of a winding path, but all along the way, I felt that I was, leading in some capacity.
Huh. So from the patient advocacy aspect, growing up in rural Pennsylvania and understanding the huge deficit in healthcare and access for rural Americans, talk to me a little bit about the connection between your experience in rural America and getting into patient advocacy.
Yes, for sure. So, and I'm so new into the advocacy role here at Pharmacosmos. We've actually just created it. So, part of my real initiative in my career is also, changing the face of pharma and having, stakeholders recognize that pharma definitely brings value, has resources, and should be a partner amongst all stakeholders in breaking down barriers to access for patients. So in rural PA, firsthand from a family perspective, right, I was able, I guess I'm fortunate to observe family members not having the access to the care and things that they need. So that was really, really tough, yet inspiring. Then, through my career and the moments before I was into leadership, I was able, to represent brands that were really medically necessary for patients. And I, spent a lot of time observing what the obstacles to care were for those patients. And I think in pharma, our responsibility, right, is to assist in increasing appropriate patient identification and then breaking down those barriers to access. So anywhere from, pharmacy benefit manager, step edits and prior auths to, pushing patients to less than ideal therapies for what their needs were discussions that I was able to have with, the customers or the physicians or the providers that I was trying to partner with to help their patients. So that's really where it started. But there were definitely a few brands that I've represented in the past that felt more like a crusade. One we lovingly called the Medicaid Crusade in Pennsylvania, which was, we also joke that it's like the MBA, the street cred MBA. As you really have to just roll up your sleeves, get to work and figure things out. But it's the most valuable experience you can have. So it's it all stems from that desire to help people and to fight for people so they can get what they need.
Sure. From my experience in the kind of rural healthcare landscape, it's always been, the distance to treatment is so far and in between. And so when we think of like preventative care and doing those screenings early, there's a huge gap and a huge need just because of the distance from the treatment facilities. And so it's kind of neat here in Arizona. A lot of doctors volunteer and they'll go all the way up to northern Arizona to some of these remote areas to ensure that, patients aren't getting diagnosed at stage 4, stage 5. They're getting the preventative testing and care that they need in advance to really be able to fight cancer if it is, especially if it's a genetic or hereditary, I should say.
Yes,
So
absolutely.
I think it's interesting.
And even so, it can be multifactorial, right? There's a lot of instances where you can get the patient to the care, but then they can't afford the care, or they don't have access to the care if they can even get there. So it's so many obstacles, and it really comes down to the patient. Their home environment, their professional environment. I think through my MHA, I started or embarked on my MHA with the idea that the resources are there. We just need to, disseminate them better. And I completed my MHA 2 years later, realizing that it's educational level and health policy. And it's definitely really, really multifactorial and difficult, but it takes a grassroots effort, but also a high level effort as well.
Yeah, I really appreciate the distinction between studying it and then going into the actual space and then kind of, reporting back on what you found. How did you feel like the curriculum was compared to like your experience in the field now?
Interesting. So my undergrad was also healthcare administration, and my master's is healthcare administration as well. I think the experience that I have from an educational perspective has really allowed me to have better conversations and discussions with my partners or customers or different healthcare providers, because we're able to speak the same language. From a pharma perspective, there's definitely still a disconnect amongst the masses, and pharma has to own part of that as well, where maybe the culture of certain companies or the objectives of certain companies, or even just marketing messages and how we're presenting to our customers doesn't really align with what seems to be best for the customer or for the patient. So I think that's been a little bit of the obstacle, and in the through school, different stakeholders or professors, like you could feel that was evident, where pharma may have been frowned upon because of the stereotypes or the behaviors of some companies.
Sure. Yeah, we've had guests on the show before who have kind of shed light to some of the ways in which the industry gets a really negative rap, and how important it is to integrate the actual kind of connections between all the entities in medical school, so people understand the amount it takes, for instance, just in research and development, like how much money it takes to do the research and development to bring drugs to market, to understand kind of the nuances of that, instead of just kind of putting it behind, let's say, like a stereotype of capitalism and greed. Not saying that everything's been, beautiful and perfect, because it never is, but just having more of that awareness and exposure to it, I think would hopefully help with some of the disconnect between what in theory is being discussed in curriculums and then maybe what's actually happening, or to bridge that gap a little bit more.
Yes, absolutely. And that's where I feel part of my, career and life mission is to help bridge that gap in understanding of, the R&D component is one piece of that. But, once you actually get to the point where you've spent, invested so much for research and development, and then you have a product and you're ready to deliver it to the masses, I mean, that comes with a very high price as well in order to open up access. So whether it's, resources from patient services, or it's, contracting with the managed care landscape as well. So it's really, really costly to bring drugs to market. It's really costly to open up access. And it's a little bit of a cycle. And it takes all stakeholders to really come together to discuss what matters, what's valuable for everyone. and that patients are able to receive the care that they need. So collaboration amongst stakeholders is something, and I'm embarking on Doctor of Public Health at Tulane University this fall starting, and my capstone will be centered on, breaking down barriers for access through stakeholder collaboration. So
you are such an overachiever. I love it.
I don't know about that. I just want to help people.
No, it's so great. I love it because I am too. And, I'm saying it in like a joking way, but some people just from a very young age are just like ready. Like you're just like, feet on the ground, ready to go. And it's like, how can I help people? What can I do? And it's incredible. It's inspiring. So tell me a little bit about your leadership approach. So you're in a position where you're communicating with all different types of stakeholders. Talk to me about the type of leadership skills that you lean on the most these days.
Oh, goodness. So I love the concept of leading with empathy, just because everyone's always dealing with so much more than what is currently in front of us. So I definitely try to deploy that in my leadership. But prior to that, it's always, demonstrating that as a leader, I can go to work too and roll up my sleeves. I am committed to ensuring that my team understands that I can do the job. I am right there alongside of them. I will work just as hard or harder than everyone in order for us to, meet the objectives and goals of the team. So it's a combination of empathy, collaboration, and just good old-fashioned work ethic, I think.
Yeah, when I think of the leaders who really inspired me the most, they were exactly how you're describing. They would roll up their sleeves and they would be right there with you, toe to toe, working hard, just working hard, being kind. It sounds really simple, but it is so powerful. And I'm really appreciative of the level of literature that we have now to really show the difference between leading with authority and denigration and shame and leading with love and in many ways, respect, autonomy, empathy.
Absolutely. So I'm a big fan of Brene Brown.
Yes.
And I think I align, mostly the concept of, vulnerability being our greatest strength. I see that play out daily. And from a leadership perspective, when you also demonstrate that you are vulnerable, right? You're not perfect. We don't have all the answers, but we're willing to figure out the best way to move forward. I think that really goes really far with each team that I'm a part of, for sure. Even the last week, embarking on some mentorship opportunities. I'm feeling a shift where I, for so long felt that I was just doing the work and working alongside of everyone. But now it's like I'm moving to a point where I have to better articulate the things that I'm doing so that I can share and, help people replicate some of the things that have worked for me. So that's definitely a mission that I'm working on, is like reading the articles, the literature, the different thought leaders to see, what really is it that I'm doing that's working.
Interesting. So when we spoke before, you were talking a little bit, and I relate to this so much in terms of, it goes with this question of the non-linear career path. And you've shared, your career path has been a bit of a mystery to you, but one that you've embraced. Just like now you're talking about embracing this aspect of mentorship and leadership, maybe in a different capacity. Tell us a little bit about how your career path has been kind of this mystery and that you've embraced.
Yes. And so sometimes pharma, right, will lend itself to a little bit of volatility, right? It can be completely tricky. And the person that I am, really, I want to work hard. I want to wear many hats. I don't want to just show up and check a box and deliver a marketing message and, work from 10 to 2 or something. All those horrible stereotypes that exist in large companies. That's not who I am. So I've always been in small, mid-size, or startup pharma companies. And in that realm, you're going to have great experience but it's going to be a winding path. And once I embarked on the leadership role in 2015, I thought that I was with a company that I would be at for another 15 or 20 years. And the leadership decisions didn't lend that to me. So I ended up transitioning to another company, and then again, I found a better opportunity and then was downsized 3 times in a row. So from 2015 to 2020, I was really with 4 to 5 different companies. And at that point, you start to question, like, am I on the right path? Am I doing the right things? How is this valuable? How can this translate to really what I want to do in my career? And through that, they were all startup companies, and I was able to build my own team from scratch. And after the fact, after the turnover and the churn, I recognized that building a team from scratch is probably the best experience as a leader that you can ever have, because you have to go into it knowing exactly what you need to do, knowing exactly the right people that are going to help you get the job done. And then you have to turn over the success really quickly. And in doing, having that sense of urgency, you have to really think and understand and get things down to a science. So that was, the windy path for sure. But now looking back, it all completely aligns with, the things that I need to do, engaging with stakeholders or, leading the teams to do so.
That's so interesting. So you sound very resilient. I mean, what kind of resilience practices? I mean, that must have been extremely stressful,
Yes.
the volatility of it. How did you cope? What kind of things did you do to keep this resilience, which is clearly just beaming?
Well, thank you. So there's a few behaviors and characteristics that are, kind of tough to, they're very tough to train, right? You can't train it. You just have to go through experiences in life and learn from them. And I was born just this absolute eternal optimist, right? I always share the story that I check my mail every day. Like there's a present in there from someone somewhere. And like, it's just junk mail. I'm like, oh, tomorrow's another day, it's always like just been part of who I am. I shared a little bit earlier, growing up in adversity, dysfunction, rural areas, right? You learn to be tough. I've been riding horses since I was 6, right? They're 1,200-pound animals. You fall off all the time. The more you ride, the more you fall off. And I've just learned through life that you have to be resilient. And life is, just as beautiful as it is tragic, or just as easy as it is difficult. And in order to have all of the experiences, you have to keep trying. And if you truly believe in a goal that is set out in front of you, then you will keep working toward it, regardless of the setback or the moments when you have to stand still and reevaluate. You just keep moving forward. So I wish you could really coach resilience, or I wish I could put it exactly explain why, but I think it's life experiences and recognizing that it's not going to stop. And if you want to achieve your goals, you must keep going. So that's definitely something when I'm creating teams or building teams, I look for resilience, right? I look for people that are not afraid to get back up after they've been knocked down, or that have been successful in really adverse environments. Like startup, or, not to say that not having managed care access on a product you're representing is an adverse environment, but it's difficult, right? So you want to seek out people that you've uncovered that they've overcome obstacles in order to really get to the point or do well in everything they're set out to do.
Yeah, I've been thinking of the book. I might butcher the name, but I know the name of the book is Grit, but I think it's Angela Duckworth, but she talks about the concept of people who have grit, and they develop the grit based on, adverse experiences, overcoming challenges, and their mindset is so focused on we can make this happen. We'll figure it out. Like, we'll figure out a way, one way or another. There's a road, and you're right. I think it is challenging to teach, and it's something that is like a characteristic that builds throughout that experience. I always tell people, after I read that book, it was in a book club, and I remember finishing it, and we're all talking about it, and I'm like, I am like super gritty, and it doesn't sound like a good thing. It sounds like a negative texture.
Yeah, unless you're from Pennsylvania, right? Like, so like the Philadelphia sports teams, right? I think they're like the epitome of grit. But Bryce Harper, baseball player that I absolutely love, in one of his interviews, he was speaking about the Phillies and how like they show up every day because of their fan base is the grittiest fan base. But he mentioned that it's like PA blue collar grit. Like, they don't want any excuses. They want you just to get out there and do your best. And that's exactly what it is. So like, grit, I think, is an absolute compliment, and it's something that, is not bestowed on everyone by any means.
Yes. Yeah. No, really well put. Great example. So tell me a little bit about how you can share with our listeners how people can find their calling, how they can find their purpose. Like, how does one go about finding their calling?
That's such a good question. And I've thought about this a few times. So I embarked on The Artist's Way. It's a creativity workbook for artists, but I think it's really for everyone. I think everything you do is art, right? I think how you communicate, how you dress, how you show up, it is really, really art. Or your career should be looked at as your craft, right? And your art. So one of the questions as you're trying to understand what your life goal is was to what makes you cry still, like, for your whole life. What, like, and I will well up just thinking about this. So like, there's two things, right? The underdog, the person who needs help, whatever it is, right? I think of this one kid on my school bus in middle school. Like, I would fight for him. Or, the other part is, if someone needs to be diagnosed and treated, right? I still have obstacles in healthcare in my family. And, it's being an advocate some way, somehow. And that's how I've known, right? That's why this has always worked for me, is because I'm super passionate about it. So if you ever have the opportunity just to sit down and think to yourself, like, what makes me cry? Mm-hmm. And that's one part, right? It's helping the underdog. It's helping, people, humans. But the other part is animals too. Like, I shared the story just the other day. We had a deep freeze in Florida a year ago for like 7 days, and the lizards were freezing on the fence. So like, I was I brought multiple lizards into my laundry room and let the dryer run so they could warm up and not die. Like, I can't just, stand on the sidelines and watch somebody be negatively impacted or hurt, whether it's a person or an animal. And I think that this career in healthcare aligns with that. So,
yeah, no, that's so beautiful. I have never thought about it like that. And I think to myself, you are the real deal. Like, there are not enough of you in the world. I mean, think about it. It's such an incredible thing to use as your framework. And people say things like that, but it's like, when you say, like, if someone is like bullying someone else or hurting someone else, you will not stand there and tolerate that. You don't want to see pain. You're a hero. Yeah. You're a hero.
Yeah. So last night, I love when things just organically bubble up, right? So last night I was thinking about this conversation, and I'm like, what am I going to say? Where am I supposed to start? So I just finished the book, The Women by Kristen Hanna, which is the main character is a nurse, but she grew up in Coronado, right? Privileged, well-to-do family. her father was an Irish immigrant. Her mom, very, society lady for sure. Brother went to the Navy, Naval Academy. So very much like well-to-do family. And they had in their house a wall of heroes, which was all of the people, all the men in the family that served in the military. And it was the hero wall. Well, she, at one moment, is standing there looking at the hero wall with one of her brother's friends. And she observed, like, there's no women, only the wives. The only women represented on the wall were wives. And he said, women can be heroes too. And that was like the very beginning of the book. And then she enlisted and she went to nursing school, and then she enlisted, and her father, even until the end of the book, wouldn't acknowledge that, she should be on the wall of heroes because she was a woman. Oh. So it was really, truly a powerful, powerful book. And I thought to myself, like last night, that I would like to bring that into this conversation somehow, that women can be heroes as well. And then after that, I thought, like, I think about all my mentors and people that have made a difference in my life. And I just sat down and listed everyone, all the way from, first grade, like my mother, to my first, second, third, fourth grade teachers, all strong, independent, smart women that made such a difference for me. There's definitely a handful of men and mentors that were leaders for me as well. But the women in my life that were absolute heroes, I think really helped shine the light on my path all the way forward. So pretty awesome.
No, I appreciate that. I wrote it down. So it's the women, and who is the author?
Kristen Hannah, Kristinhannah.
I'll put it in the show notes for our listeners as well. And it's unfortunate that throughout antiquity, traditionally speaking, women in art, women in literature, women in history have really been, for the most part, representations as extensions of the male patriarch. And so that concept of the hero wall is so familiar to me as an Indian American woman. I specialized when I was in my master's program in the early modern period in really studying Shakespeare. And at that point in time, something that totally blew my mind. And I went down the rabbit hole of supreme dorkiness, literally just day and night in the library, trying to find as many of these images as I could. But what they did is, before the men actually died, they would have the wives pose for their widow portrait. And the concept was, hey, before I die, I got to make sure you nail this picture because it's a representation of my legacy. So if you don't have like the perfect mourning look, if you have a little bit of a smile, if you look a little bit too attractive, like it was like crazy. There were like tips for widow rules to say, this is what the portrait should look like. And so it just makes me think about the concept of how, again, we've always really been treated as extensions of the patriarch, and the representation is to be there to support their legacy. And so I'm super excited to read this book. I sincerely appreciate the recommendation. And
excellent. And there's a few different themes all along the way. Like women, there were, I think, 10,000 nurses in Vietnam, and only a few lost their life. But it was like, it took so many advocacy groups to get the I think it was 8 or 2 nurses, I can't remember the number exactly, that lost their lives in Vietnam, to actually have them on the memorial wall in Washington, D.C. So they were in trauma hospitals, right? So they have PTSD, and everywhere the character went, Frankie McGrath, everywhere she went to seek help in VAs or any hospital setting, the response was, there were no women in Vietnam. You didn't see combat, you don't count. And the themes of the book, it's still frustrating to see some of those themes still bubble up today for all of us. So
yeah, I couldn't agree more. I'll send you a book recommendation, and I'll put it in the notes as well. It's all about kind of the difference of the having daughters in traditional dated fashion, but throughout history, same thing, the way in which the birth of a daughter happens compared to the birth of a son. And it's great to shed light to this through literature, through art, through conversations like the ones that we're having. So it's not, happening as much because it's so blatant, once you point to it and say, hey, this happened and these women did exist and they were heroes and they are heroes and they're here right now. Yeah.
And that's why I just feel so blessed. My whole path, right? My guiding stars were women 95% of the time.
It's incredible.
Yes.
Incredible. I would say the same. Yeah. My mom is super, super strong. My mom's sister, in my language, we say masi. It means your mom's sister. And they're both incredibly, incredibly independent, go against the grain, strong women.
Yes.
in our like I'm like loosely translating, but in our language, you would say like they're the women who talk back, and that's like a good thing.
Exactly.
Yeah.
So both my grandmothers were super feisty and well beyond their time. And then my mom the same. And my mom had 6 kids, five girls and 1 boy. So it was a really strong, female environment where, but still all of us always willing to fight for the underdog. Right. So yeah. All kind, empathetic, but very strong-willed women. I say that I'm like the caboose in a long line of rule breakers.
Yeah,
those aren't meant.
Trailblazers, rule breakers. The incredible quote, like no, I'm going to butcher it, but it's like no, like women who follow rules seldom make history.
Yeah, exactly. Yeah. Yeah, I love that.
Yeah, me too. So looking ahead, what changes or trends do you see coming up in the healthcare pharmaceutical world? Tell us what's next, how we can continue to follow you and your incredible, incredible stories. And what do you see in the future?
So goodness, that's there's a lot of topics in that question. But for me, I'm humbled to think that anyone would even want to follow my story. So I'll just keep working and doing what I can. But I think right now we're actually at a pivotal point in healthcare when it comes to shedding the light on some of the dark corners. Right? Sometimes I feel a little bit angry that SDOH and inequities weren't really recognized until COVID. Like this is nothing new. But I think through COVID, we became better because we had to within healthcare. So I think, decreasing inequities is definitely on the forefront, whether it's from me or, other partners or colleagues within pharma. Stakeholder collaboration to reduce and decrease those inequities is certainly a hot topic. Just now, like the FTC has opened a case on PBMs. The Community Oncology Alliance, they're doing a lot of great work when it comes to educating government through policy and legislation opportunities to decrease barriers of access to care. So there's so much happening in healthcare right now, and I think it's because the light has been shed on the darkest corners, and it's always it's great. It's good to see. It's been a long time coming, but it's not where it needs to be yet. So just keep following and observing, reading the articles and things on LinkedIn or wherever you possibly can. But lots of opportunities out there.
Yeah, and please, if you get a chance, I know you do already, share some of them. There's so much happening so fast, and there's such an abundance of information out there. So we'll make sure to put your LinkedIn and any other places where we can follow you in all of the notes. And love following you and just continuing to learn about these developments as, the healthcare sector is obviously always going to be continuing to evolve and change and improve. And so having all that information at the forefront, I think a lot of people find it a little bit intimidating to follow and understand because there's just so much of it. And so I try to follow people like you where it's like, you're at the forefront and you know what's happening and you're keeping us educated. So thank you for doing that.
healthcare is so difficult to navigate, right? So any opportunity to bring it down to the consumer level is really helpful, and will definitely, assist patients in finding what they need. But everybody needs a healthcare advocate. It's crazy.
Yeah, even shedding light to the nonprofits and the various organizations who are doing great work and supporting patients. I think it's always just incredible when patients don't know about these entities. And just from something as simple as like posting it on LinkedIn, having that connection and then having the story from them and their feedback to say, hey, I had no idea that this wonderful organization exists to support us. And thank you for connecting, because now I was able to meet these needs, which, drastically improved my chances of beating, whatever the therapeutic area is. So thank you for that.
There's so many advocacy groups out there, right? And for Pharmacosmos, what we're embarking on from an advocacy perspective is partnering with patient advocacy groups, professional societies, and agencies, and then across stakeholders through key opinion leader engagement. So it's definitely there's so much out there. It can be overwhelming, but depending on the challenge that you're facing or the health concern that you have, there's a plethora of information. And if you have somebody in the healthcare industry that that is working either in that class or for that disease state, and regardless of what their current affiliation is, they'll have an understanding of where to go to find resources and to help with what is needed.
Right. I really appreciate your patient-centered focus. It is so at the forefront of everything that you represent, everything that exudes. It literally beams off of you. It's amazing. So I'm so grateful to have you on the show. You're such an inspiration. And from a supremely selfish place, I appreciate talking to you because it's so intellectually stimulating. I need more of this intellectual stimulation in my life. So
you're too kind. That's probably the furthest thing from how I would describe a conversation with myself. But
I have a recording to prove it.
Thank you. Yeah, I am. Thank you.
Thank you all for joining us. I'm Dr. Sedna Bokiria, and this is Leader Voices. This show is brought to you by the American Express Leadership Academy Alumni Network and leaderstories.org. Leader Voices is audio engineered by Robbie Ladd and produced by Creepandian team at OTVO Digital. Special thanks to Caitlin Johnson and Michael Chang. Thank you, and see you in the next episode.